Hey community, this is Dr. Hugh coming at you, and today I got another great webinar that I've been studying, and application to get you better. And if you're a woman out there and you have female problems, this is a must lecture to listen to. There's going to be a lot of clinical gems throughout the whole entire thing, so stay tuned as I bring you the greatest thing about balancing your hormones. If you think you have a hormonal problem, stay tuned and let's get into this. Okay, so I can't imagine a worse thing for a woman besides, losing their hair. This is definitely, something that psychologically can be very, very devastating. So I really want to talk about this, and we're really going to be talking about several hormones, but one is going to be testosterone, and the second one is going to be about estrogen levels. So let's get into this. Balancing hormones, high testosterone. Do you have it? Is it a bad thing? It is definitely a very, very bad thing. Okay, so here what you see is, if you want further information on this, this is my website. So if you're watching this on video, you can stop it. You can type in this my website, and then you can go in and do a little more research. But what I'm going to go over is what normal cycle should look like, what estrogen and testosterone should look like. So this is a really good visual. So up in here, you see this is normal. So this is day one. So what is day one? So day one would be when you first start to bleed, the first day of menses, and then there's day 28. So you can see here, this pink or red area, pinkish color is estrogen. All right, and then the green down here is what we call testosterone. So you can see here throughout the whole entire month, estrogen raises and it goes up. It kind of goes up and down. And then you see how testosterone is right down in here. Now, when you have problems, right, when you have PCOS, high testosterone, high insulin, or inflammation, look at this. This is shocking. Here's testosterone. What do you see right here? Testosterone remains high the whole entire month. And now look at what's happening to estrogen. So this is a very, very significant thing. Now, a lot of things can cause high testosterone. There's lots of things that can cause high testosterone. Bad gut, just high insulin, high glucose, high sugar. Concussions can cause this. Food sensitivities can cause this. Having not enough hydrochloric acid. So there's a lot of things that can cause this problem. So if you're out there, if you're watching on YouTube or wherever, subscribe to my station, give me a thumbs up, share this content because people need to know this. Ladies need to know what is happening here. Okay, so then again, I just want to go over this one more time here, is what you're really looking at is the normal levels right in here, and then the testosterone stays high pretty much the whole entire month. Now, what are some common causes of this? So when they say androgens, okay, excessive androgens, we're going to just summarize or lump all the androgens, which would basically be male hormones together. All right, there's a bunch of them, but that's what androgens are, male hormones. Excessive insulin, genetics. So there's nothing that we can do about genetics, right? But a lot of things that we can do about this. Inflammation is a problem, and then lifestyle factors. So out of the 5 factors, there's 4 things that we can personally change on your case right now. So if you're out there suffering with hormone problems, I want to let you know you need a polytherapy approach, meaning this is you need to take 5-6 different things and apply it to your case in order for you to get better. So there's no magic bullet. There's no one thing that's going to solve your hormonal problem, your fibromyalgia, your female pain, whatever it is. You got to take a polytherapy approach, and that's what I do. I look at a polytherapy approach, and how can we, on a polytherapy approach, increase your God-given healing ability? Okay, so these are all possible symptoms of excess testosterone and insulin. So excessive hair growth, weight gain, ovarian cysts, low libido, irregular periods, male pattern baldness, like when your hair starts to fall out on the top of your head. This is an estrogen dominant problem, insulin dominant, pro-inflammation. Your body's massively inflamed, insulin resistance, fatigue, acne, mood swings, and trouble conceiving. So all these things here can indicate poor hormonal balance. So what I want to go over in this graph right here is, besides testosterone, progesterone, and estrogen, which we'll be talking about, there's other symphonies or harmonies of hormones in your body. Now, you've seen this here. This is the normal phase right here. We have estrogen right here and then the testosterone. Now, this is your ovary right here. So you see what happens. This would be day 1 down here. And then around day 15, this right here is ovulation. You see that little thing popping out? That's the egg popping out of your ovary. Now, when the egg pops out of the ovary, then your progesterone starts to increase. But what I want to show you is all these balances need to be in harmony. Like they need to be like an orchestra band playing. Everything needs to be in harmony. So you're going to see a couple hormones here. You're going to see FSH and LH. And you can see here what happens right around when you ovulate. This is the ovulation, this big estrogen spike right here, the eggs popping out. Now at the same time, what happens is your FSH goes up and your LH goes up right in here. So this is normal pattern right in here. Now, this is what happens when you have high insulin, high testosterone, and you're massively inflamed. Look at LH and then look at FSH. It's flatline. Now, if you compare this up here, you can see generally what happens is your FSH is higher than your LH in a normal, healthy woman. Down here, what's happened is we have the exact opposite. We've switched it, so we have LH up top and FSH on the bottom, and then this causes massive amounts of problems when it comes to your cycle. Okay, so you want to stay with me on this because I'm going to go over how your female hormones work in your body, but stay with me because then you're going to understand what's happening. So all your hormones here come from cholesterol, all right? Then there's a pathway. Then there's the progesterone, and then the progesterone comes down here, and these hormones all up in here, these are going to be, what I'm going to say, are going to be the male hormones. This right here, progesterone, is the female hormone, and then this is the estrogens down in here. This is the female hormone as well. So this is a symphony. We need to make sure this whole orchestra is working properly. Now, here's what happens. Generally speaking, women that have hormonal problems have insulin, which is a hormone that's out of whack. So let me show you this right here. So insulin is produced by your pancreas. You must get this checked. Fasting insulin is very critical. Now, for example, here, you see this range. This is the range right here. You see that it's a super broad range, 2.6 to 24. Here you can see that range, 2.6 to 24.9. So these are all my clients right here. So the sweet spot, we want your fasting insulin to be between 4 and 7. So fasting insulin is a pro-inflammatory hormone, meaning this: if you have above 4 to 7, your body is in a state of chronic inflammation. This increases your insulin. This increases your testosterone. It increases all these male hormones in your body called androgens, and this is when you get the hair falling out, the male balding, all those things that we went over. So this right here, these are all high. This actually just came from a patient today. Actually, you see here, 29 high. Now, one of the things is when we manage patients, we manage clients, we always check insulin. And this is one of my clients. You see down here, started at 23. So this is the lab range. See 23 high. And you can see here, then we checked it again. And it's down to, let's say, it's down to 11, 5.5, 5.6, 3.7, and then 4.1. So what did we do with our pro-inflammatory hormone insulin that's messing up all our hormones, causing all hormones out of whack? What are we doing? We're putting them in balance. Okay, so you got to check insulin. Now, let's go back to this picture right here because this is very, very important. Now, you can see here, this estrogen right here, this is estrogen right down in here. This is the female hormone right in here. These are all the male hormones. This category right in here is called androgens, just male hormones. And then we have progesterone right up in here. So here's what happens. If you have high insulin, ladies, guess what happens? I'm going to put a big line right in here, okay? So your hormones, what has to happen right here is progesterone. Your cholesterol has to go down, your progesterone has to come down here, and it has to be converted to estrogen. Now, if you have high insulin levels, if you're inflamed, this conversion does not happen. You are stopped right here. This is stop. This is stop. So what happens when it's stopped? What happens here? All these male hormones start to what? They start to go up. So you're not actually producing any estrogen in your body. Let me blow me up because I want you to see my physical space, my physical face. So if you have high insulin, the conversion, all these hormones up in here don't get converted to your female hormones, estrogen, and that throws your cycle completely out of whack. Okay, so if you have high estrogen, or excuse me, if you have high insulin, this is not converting, it's not aromatizing, that's the word, to estrogens, and this causes you not to ovulate. And if you're not ovulating, the only thing that produces progesterone, or 90% of progesterone in your body, is the egg when you ovulate. So when you ovulate, a little egg comes out here, and that produces progesterone. So if you are not ovulating, you are not producing progesterone. Progesterone is pro-life. It's the hormone that gives you vitality and youthfulness. So when you have high insulin, high testosterone, and you're inflamed, and if you're inflamed, this is going to mess up this cycle right in here. So if this is going on in your body, really what's happening here is that you have low estrogen, or you don't have enough estrogen, and then you're not producing any progesterone. So it's not like you're estrogen dominant. That's really not what's happening. You have testosterone that's high, you have estrogens that are low, and because your estrogen is low, you don't actually ovulate. So now you don't have any progesterone. And God gave you these hormones to work in symphony, in harmony. So we need to get to the root cause of the problem here. Now, really quickly, for men, if you're watching this, or just so you know, so what happens in men is when they have high estrogen, what happens is this progesterone is easily converted into estrogen. So that's why men will get like man boobs. Why do they get man boobs? Because their hormones are easily getting converted into estrogen. So in men, this is sped up. It's easier to convert progesterone, or these hormones, into estrogen. Now in ladies, it's the exact opposite. So with you ladies, what's happening here is this conversion is not taking place. When this does not take place, when you don't have enough estrogen, estrogen causes your uterus to let out an egg. So the egg pops out right here. When the egg pops out, then the egg produces progesterone right here. And the progesterone is what really causes nutrients to your uterus. Like the progesterone is like the nutrients to the uterus. It gives it good nutrition. It gets gorged with blood. This is going to cause your uterus to be youthful. So you need this harmony. You need this cycle to occur. So if you're out there suffering, get in contact with me. We can do a polytherapy approach and figure out why your cycles aren't working correctly. So let me show you this again. So all this is high insulin. These are fasting insulin, 38, 24, 11, 29. Bad news. Okay, here's a case that we actually worked with. We got her down to 4. Beautiful. Now here is a great paper. So this isn't Dr. Hugh's opinion. There's actually papers on this. If you grab this link right down in here, you can grab this link right down in here and go here, and then you can download this whole paper. So let me just download this paper here, and I'll show you this here. So this is the paper that I referenced here. This is a really huge, massive paper. If you go down here, look how many references it has. This is the references right in here, right down in here. This is the references right in here. So we're on page 32. It has over, this is insane. It has over 200, it has 234 references. So this is clinical research data. This is cutting data research that's out on PCOS and hormonal problems. You can see when this came out right here, 2021. So this is a really good paper. So if you want to geek out on it and figure out, so it's not my opinion. This is actually research on actually what's happening in your body. These are all the things that have been shown clinically research to help balance hormones, decrease estrogen, decrease insulin, and get the your female organs working better. DHA, which is a fat, inositol, berberine, curcumin, red yeast, probiotics, and supplements. So there's a lot of things that we can do to try and get you better. There's lots of things that we can do. But at the end of the day, what I really wanted to give you and show you is the symphony between these hormones and what's actually happening with your body. And really what is happening at the end of the day is this testosterone level is always high. And the testosterone, just to summarize what we're going over, is the male hormones. All these are the male hormones, which are in summation called androgens, which increase when you're inflamed, when you have high insulin. And there's a lot of things. When you have low vitamin, there's a lot of things that can cause all these things to spike up. So anyway, if you like this, give me a thumbs up, subscribe to my station, reach out and get a hold of me because you can get better. And remember, is where there's help, there's hope. Take care. Bye-bye.